Hi, today I thought I'll talk to you about the RTPCR test and what it means when it is reported as positive. Because the COVID wave is in full swing now, many families are having someone or the other who is having symptoms and is tested and comes out positive. And when the rest of the family, who are probably completely asymptomatic, are tested because they are staying with them or her, they also come out positive, then it is quite panicky situation, especially if it is a child and the family doesn't know what to do. So, well, on receipt of the RT-PCR test, the family first looks at the CT number. I'll explain very briefly what exactly the CT number means, because most people think that a lower number is more dangerous and a higher number is more, safe. The CT number is just one way. I'll explain it to you in a very simple way. Like, suppose if you are able to see this big circle with the current magnification of the camera, and if I put a small dot, you need to increase the magnification of your camera maybe 40 times to see that small dot. So that means with a smaller magnification, you are able to see a bigger circle. So in a smaller number of the CT number, the assumption is that there was a lot of viruses, and so the test picked it up quickly. Whereas if the number went on to closer to 40, then probably it was a very small dot to begin with, a very small number of virus, and hence it took extra number of magnification to pick up the viral protein. So that's all. So it doesn't mean that a lower number is more serious and a higher number is much more safer, because at that point in time the number of viruses in the throat might have been less or more, and as the days passes we know that the virus numbers will slowly go down unless the person has much more serious comorbidities or has an immunological problem, when the virus numbers will keep on increasing. So the CT number shows the number of viruses probably on the day of the test. And also there could be some problems with the testing method which might increase or decrease the number of the CT count. So the important message is that if the RT-PCR is positive, that means the virus is there. So don't worry much about the CT number. Now, as the result is obtained and the family is not able to decide what to do, the most important thing is see how the person is. Suppose if it is a child, how is the child? Is the child well in themselves? If they are very well, then please rest assured nothing needs to be done. Because like I said before, the severity of the COVID is of 6 categories: asymptomatic and pre-symptomatic, then mild, moderate, severe and critical. Those who are moderate, severe and critical are probably already in hospital when they receive the RT-PCR test. But we are today going to address only the first 3 categories: the asymptomatic, pre-symptomatic and the mild. Now, because I'm a pediatrician, my thing addresses mostly to children, but I think it should apply to adults as well. At the end of this video and in the description below, I will put the link to the All India Institute of Medical Sciences, protocol or the flow chart, which will explain it much more clearly. So those who are asymptomatic or pre-symptomatic, they need not have any further testing done. They need not have any further treatment done. No treatments or no testing for any problems, like no blood tests, no x-rays, no CTs, nothing. And they do not need another repeat of the RT-PCR test in 10 to 14 days time. So that's about the asymptomatic and pre-symptomatic people. The mild symptomatic people, like I have explained in a previous video, they could have fever, cough, cold, or a little bit of vomiting, diarrhea, stomach pain, body ache, etc. They need only treatment for those problems. And if those problems are getting aggravated, they need to consult their doctor to get advice on how to control those. But they don't need any specific testing or treatment for the COVID related infection or the COVID infection. So currently many adults, they get lots of treatments which are given to them by the doctors, but in pediatrics, we do not give any treatment to the children. Even if they are mildly affected, then we just treat their fever or the headache or the body pain or the vomiting or the diarrhea, etc. We don't give many of the other medications like antibiotics or antivirals, etc., which many adults get. Then comes the notification. So as you get the test result positive, please remember that you should notify or inform your doctor that your child has or your family relative has a positive result, and also you have to inform the local authorities if they don't already know about it. Then what you can do is you can monitor the oxygen saturation twice a day or once a day as the condition of the person is, and then you can monitor their symptoms. If the symptoms are getting worse or the oxygen saturation is going down, then obviously you need to inform your doctor because the person seems to be getting worse and they might need more closer attention. Now, if the RT-PCR test was positive after the person got vaccination, full 2 doses of vaccination like it has happened now, or they have had COVID illness in the past like 3-4 months ago during the early phase of the infection, or they have been negative very recently and then again turned positive. These are all the various scenarios that are happening. They need more detailed attention from your doctor. It's very difficult to describe on this video because a lot of scientists are still working on these issues. So what I wanted to leave you with is that if the person is asymptomatic, pre-symptomatic or very mildly symptomatic, they don't need any specific tests or treatment for the COVID. That's all. Thank you.